Hi, it's Danny. Welcome back to Danny's Rig. This video is a continuation of our series on common drugs EMTs can give. Just so you're aware, medication administration is a complex topic, but we will just be focusing on how it relates to your duties as an EMTB. This video will be covering aspirin and nitroglycerin, but be on the lookout because other medication videos will be coming to you shortly. So let's start with aspirin, since it will come before nitro in our sequence of drug administration, and throughout this video you'll see what that sequence is comprised of. So here's our patient. You are called to Mr. Jones's house. He is a 75-year-old male with a history of coronary artery disease and asthma. Mr. Jones's wife explains that she found him on the couch watching television when he began to experience chest pain. Mr. Jones states that he thought it was indigestion, but it just will not go away. Mr. Jones's medication history consists of metoprolol and nitroglycerin PRN, or as needed. For our purposes, aspirin will be given as a cardiac drug. Again, refer to your state's protocol on this one, but in my state and most other states, aspirin can be administered by a basic for chest pain related to a cardiac episode. Yes, we have other indications outside of our EMS world, but these other indications are not included in our scope of practice. Once it's established that your patient is experiencing chest pain that is cardiac in nature, meaning that it's not because of a trauma like a stabbing, but it's due to a sudden medical onset, you want to assess your patient and ask them questions at this point because you want to find out if they're a candidate for chewable aspirin, since this is the first drug that we will be reviewing. Hi, Mr. Jones. I'm Danny, one of the EMTs taking care of you today. We are considering giving you aspirin to help with your pain. I first need to ask you some questions to make sure it will be safe for you. Have you taken medication or other steps to help your pain?
No, I haven't taken any medication. I just have been laying here on the couch.
Be sure to check your state protocol in terms of the dose. Sometimes, if the patient took aspirin prior to EMS arrival, you can still give the aspirin but in a smaller dose, but other times you won't be able to give it at all. Mr. Jones, have you had any recent medical incidents or surgeries?
I did have a knee replacement 6 months ago.
Okay. Did you have any bleeding, particularly in your stomach or intestines?
Oh no, nothing like that.
Aspirin is contraindicated in GI bleed, since it can irritate the stomach lining and aggravate a bleed. Mr. Jones, can you please confirm your allergies for me?
Just penicillin and kiwi.
So no allergy to aspirin?
No, I just took some a few weeks ago.
As for any drug, check the patient's allergies. There are some people allergic to aspirin, so you'd not want to administer this drug if they were allergic to it. All of these factors, which would prevent the patient from being a candidate for aspirin, are known as contraindications. After ensuring that the patient meets this criteria, you could give the patient aspirin, but keep in mind that while you give the aspirin, there could be co-occurring procedures in your state protocol. This means that you may be required to administer oxygen with the medication, or maybe begin a 12 lead if your state approved BLS 12 lead. So once again, check the protocol. Okay, Mr. Jones, we are going to give you a dose of chewable aspirin. I'm going to hand them over to you. Be sure to chew them before swallowing.
Okay, I could do that.
Make sure your patient is able to chew and swallow the chewable aspirin. It may sound simple, but some patients may be nervous and miss this instruction and could swallow it like a pill by accident. Swallowing whole would not be effective. The patient needs to chew the aspirin so it can absorb properly. After administering your correct dose of chewable aspirin, monitor the patient. How are their vitals? How is their oxygen level? You should expect to see an increase since this is the effect of aspirin. How are you doing, Mr. Jones?
Well, my chest still hurts, but now my stomach hurts a little, and I'm feeling kind of nauseous. Maybe I'm getting bus sick on the ambulance?
How does the patient feel? If they have nausea or heartburn, this is a normal finding since there are common side effects of aspirin. As always, don't hesitate to call your medical control phone number if you aren't sure if the patient's reaction is normal or not. Mr. Jones, that nausea you are experiencing with stomach pain is a common side effect of the medication. However, the chest pain should be decreasing. Do you have your prescription of nitroglycerin on you?
Yes, I do have it. Wifey, where is it?
Here it is, sweetheart.
Okay, great. Let's get moving on to the ambulance, and we will continue en route to the hospital.
Okay.
Now on to Nitro. Again, check your protocols. I'll just leave that as a disclaimer for each video so we don't have to keep repeating it. Anyway, in many states, EMTBs can assist Nitro for chest pain after giving aspirin as long as the patient has their own prescription with them. Also, notice I said assist and not administer. We administer our ambulance drugs, but only assist with the patient's prescriptions in most states. Check the protocols. I'm going to check your blood pressure again. Alrighty, 140/82. Nitro is contraindicated when the systolic blood pressure is too low. How low? Check your protocols. Commonly, it's 120 systolic, but save your behind and check. Nitro vasodilates and causes blood pressure to drop. And if their blood pressure is already too low, it can become dangerously low if you give the nitro, which can cause problems fast. Hypertension or high blood pressure gives us some more time to play, but if it drops quickly, then that can be very difficult to deal with. Mr. Jones, have you taken any drugs like Viagra or anything else for erectile dysfunction?
I tried it once.
How long ago was that?
Wifey, how long ago did I try it?
Was it like 3 months ago?
Well, it was longer than 72 hours, right?
Oh yeah, months ago.
Okay, good. Drugs like Viagra are the same deal as the blood pressure that we were talking about earlier. They vasodilate just like Nitro would, so that means that you're getting a double dose of the blood pressure dropping, which could again bring it to a dangerously low level. And Mr. Jones, when did you last take your Nitro?
A few weeks ago.
Again, check your protocols. If the patient took the dose of Nitro prior to your arrival, you may or may not be able to allow the patient to use it. However, we are in the clear here since Mr. Jones took it a few weeks ago and not recently. Okay, I'm going to help you with your nitroglycerin. I see you use the spray?
Yes.
Alrighty, let's spray under your tongue. There are several routes available for Nitro. Mr. Jones uses the under-the-tongue spray, but you may also find tablets or patches. Also, be sure to protect yourself when handling the Nitro, since it can cause you to get the effects too if you touch it. So, just stay safe. Okay, Mr. Jones, we are pulling into the ER. How are you feeling now?
Well, my chest is a little better, but I have a tingling and a headache now.
Sorry, Mr. Jones, more side effects. Nitro comes with a cost. There are many side effects, including headache, tingling, syncope, flushing, nausea, vomiting, and excessive sweating, which is also known as diaphoresis. Whew, well, we got Mr. Jones to the ER, and he's doing well now. We also completed our lesson on aspirin and Nitro. Stay tuned for more medications in the series. Have a great day, and stay safe out there.